As I mentioned on the therapy for polycythemia vera, the goals of treatment hopefully will change, because one of the most unmet needs is the change of the disease course. We know that at the beginning of the disease, in the first decade or two, we care more about the thrombotic risk. However, we have patients that progress with the rate of progression about 15% for PV in a decade, slightly lower in the ET. But the longer they live with the disease, the higher chances of progression to myelofibrosis, less so to acute leukemia these patients carry. And so in the second decade of living with polycythemia vera, we start to worry more about, hey, this disease is going to progress. And then we have seen some encouraging data from the Ropeginterferon, where their event-free survival has been favorable. So less patients progress, less patients had prognosis, percent they had better survival, but that has to be looked on with a longer follow-up. But definitely, that's one of the most unmet need. How do we stop the disease from progressing? Whether the changes in the molecular response that we have, for example, observed with the Ropeginterferon as the first thing ever, gonna correlate with the patient's outcome. Are we gonna translate the improvements in the molecular burden with longer life? That's gonna be, I think, the most thing that's gonna be dealing with in this decade.